Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor discusses a patient's significant improvement in asthma. Now read the question.
How are you feeling, Miss Taylor?
A bit drowsy, but much better than before. I can breathe so much easier now. I guess the inhaler is working.
That's great to hear. We adjusted your medication dosage, and it seems to be helping your asthma symptoms. You're good to go home now, but remember to avoid strenuous activities for the next few days.
Thanks. It's amazing how quickly this has improved. The last time my asthma flared up, I had to stay in the hospital for almost a week. This is a big relief.
Yes, inhalers can provide rapid relief. Just be sure to use it as prescribed. If you notice any issues, contact us immediately.
I will. It's just hard to believe how fast things turned around this time. I was expecting to be here for much longer.
The right treatment can make all the difference.
Now look at question 26. You hear a nurse educator talking to a group of nursing students about infection control. Now read the question.
When we talk about infection control, one of the key strategies is hand hygiene. It's one of the simplest and most effective ways to prevent the spread of infections. However, compliance rates among healthcare workers can sometimes be lower than expected. This is concerning because infections acquired in hospitals can lead to severe complications, particularly in patients who are already vulnerable due to underlying health conditions. Our hospitals' infection rates are actually below the national average, with only 2% of patients affected compared to around 4% nationally. But to maintain this, we need to remain vigilant. Regular training sessions, accessible hand sanitizing stations, and a culture of accountability are essential in ensuring everyone adheres to the protocols. Even a slight lapse in hand hygiene can result in an increase in hospital-acquired infections, so consistency is crucial.
Now look at question 27. You hear a physiotherapist discusses the rehabilitation plan for a patient. Now read the question.
Today, let's talk about Sarah. She's 3 weeks post-surgery for a herniated disc in her lower back. She also had some nerve compression, which was relieved during the surgery. This is her first time in rehab since the procedure, right?
Yes, that's right.
All right, we're going to start by implementing low-intensity laser therapy on the affected area. The goal here is to reduce the inflammation that's still present in her lower back and to promote tissue repair. This therapy will also help decrease any residual pain she's experiencing and improve her range of motion. Over time, you'll notice a gradual improvement in her flexibility and strength. Our aim is to restore her normal movement patterns without causing any further strain on her spine. Consistency is key in her recovery process, and this treatment is designed to facilitate quicker healing while minimizing discomfort.
Now look at question 28. You hear a medical professional explaining a diagnostic procedure to a colleague. Now read the question.
It looks like Mr. Anderson's wound is healing well after his appendectomy. Has his pain level been manageable?
Yes, he's been comfortable with the pain medication. I'm about to check his vitals before he goes to the ward.
Great. I've ordered some additional post-op checks. He had a slight fever earlier, which might indicate a possible infection. We need to keep an eye on his temperature and watch for any signs of redness, swelling, or discharge from the incision site. His white blood cell count also needs monitoring, so I want you to get a complete blood count (CBC) done twice daily.
Understood. I'll make sure the next shift is aware to monitor for any signs of infection.
Perfect. If anything seems off or if his fever spikes again, contact me immediately.
Will do.
Now look at question 29. You hear a medical professional addresses staff concerns about upcoming changes. Now read the question.
Now, you'll have received the email outlining the proposed changes to our electronic health record (EHR) system. I'm sure you've all been thinking about how this will affect your day-to-day tasks, and it's natural to have concerns. There's plenty of research showing how a more efficient EHR system can reduce errors and improve patient outcomes, which is why this update is crucial. However, I understand that the implementation process can be daunting, especially with everything else on your plate. I want to assure you that we've taken steps to ensure a smooth transition. We've scheduled additional training sessions to make sure everyone feels confident using the new system. And technical support will be available around the clock. Furthermore, we've adjusted workflows to minimize any disruption to your regular duties. Managers will be keeping a close eye on the situation to ensure that everything runs smoothly, so you can focus on patient care without worrying about system issues.
Now look at question 30. You hear a patient talking to a medical receptionist. Now read the question.
Hi, I'd like to book an appointment, please.
Sure. Who is your usual doctor?
Dr. Ahmed.
Is this something urgent?
Yes, I've been having chest pain since yesterday.
I'm sorry to hear that. Unfortunately, Dr. Ahmed is fully booked today, but Dr. Patel is available this afternoon.
I was hoping to see Dr. Ahmed since he knows my history. But do you think Dr. Patel could see me today?
Yes, she could see you today at 3 p.m. Or we could arrange for you to see Dr. Ahmed first thing tomorrow morning.
Well, the pain isn't getting worse, and I'm taking ibuprofen, which helps. Since it's related to a previous issue, it might be best for Dr. Ahmed to check it out.
Okay. Let's schedule you for tomorrow morning at